Welcome to this overview of the Children's Apperception Test, commonly known as the CAT. The CAT is a projective personality test specifically designed for children and serves as a direct extension of the thematic apperception test, adapted to suit the developmental level of younger subjects. Primarily, it is used for children aged 3 to 10 years, though in some contexts, such as Indian adaptations, it may be used for children up to 14. The key concept here is apperception, which is the process by which new experiences are interpreted and transformed through past experiences to form a new whole. The test was developed by Leopold Balak and Sonia Sorel-Balak. The conceptual origin for using animal figures was suggested by Ernst Kriss, based on the premise that younger children identify more easily with animals than with humans. It was later standardized for Indian conditions by Uma Chowdhury. Moving on to the test material, the CAT consists of 10 cards. There is the CAT A, or animal version, which is preferred for younger children aged 3 to 6, depicting animal figures in human social settings. Then there is the CAT H, or human version, designed for older children aged 6 to 11 who may no longer identify with animal characters. These cards depict various scenarios designed to elicit information about childhood-specific conflicts, such as feeding, toilet training, and sibling rivalry. When administering the test, the environment should be a quiet, child-friendly room free of distractions. Building rapport is crucial, and the examiner should present the test as a game to maintain a positive, non-competitive attitude. The examiner instructs the child to look at the pictures and make up a story, explaining what is happening now, what happened before, and how the story ends. The examiner keeps a verbatim record of the story, noting pauses, emotional reactions, and any rejections of the cards. Interpretation and scoring focus on 10 key variables. These include the main theme of the story, the main hero the child identifies with, the needs and drives of the hero, and the child's conception of the environment, also known as press. The examiner also looks at how figures are seen, significant conflicts like autonomy versus compliance, the nature of anxiety, main defenses used to cope, the severity of the superego, and the overall integration of the ego. Certain cards often yield specific themes. For example, card 1 typically explores feeding, oral themes, and sibling rivalry. Card 2 often brings up aggression or castration anxiety. Card 3 depicts an authority figure, exploring conflicts between compliance and autonomy. Card 4 further explores the child's relationship with the mother and sibling rivalry. When comparing the CAT to the TAT, the CAT is for ages 3 to 10 using primarily animal figures to explore developmental themes with shorter, less complex stories. The TAT is for ages 10 and above, using human figures to explore deeper, repressed aspects of adult personality with more complex narratives. Clinically, the CAT is highly useful for identifying feeding problems, family dynamics, and responses to discipline. Stories from a child with schizophrenia may be overly descriptive but lack imagination, while depression might manifest as decreased effort and very short stories. However, there are limitations. The structure of the story is often poor in young children, so what might look like psychopathology in an adult could simply be developmental immaturity in a child. Ultimately, the CAT is a vital clinical tool. By utilizing animal stimuli, it bypasses defenses and allows the child to project their fundamental needs and anxieties onto a safe, imaginative medium.